Hello, I'm Kris Koester with the City of Champaign, representing the county's Joint Information Center. A topic of interest lately is how we adjust our lives in the middle of this pandemic. Joining me today is Dr. Tara Powell, professor at the University of Illinois at Urbana-Champaign School of Social Work. Dr. Powell's research and practice experience is in post-disaster behavioral health and disaster-affected communities in the United States and abroad. As a social work alumni, I felt it important to talk about everyone to check in on your own mental health as well as that of your friends and loved ones. And many of us know at least one person who's in the helping profession who are working long hours during this health crisis. Dr. Powell, thanks for joining us today.
Thank you so much for having me.
Can you tell us why focusing on mental health, especially self-care to prevent burnout and compassion fatigue, is so important right now?
So focusing on our mental health is really critical right now. We're all going through a very abnormal situation. Healthcare providers definitely need to focus on their mental health, but we actually all do as well. Many of us are used to going out and about, but now we're working at home. And so by focusing on self-care, we can really reduce the possibility of having longer-term mental health impacts like burnout, like compassion fatigue. Because if we don't care for ourselves, it's very difficult for us to also care for other people.
For those of us who have children in our lives, how can we best look out for them during this stressful time?
Yeah, so for children, one thing that is key is for us to practice our own self-care. So when we're doing well, the children will do better. Lots of research has shown that a lot of times children's responses are very much related to their parents or their caregivers. But there are other things that we can do to help children. So first of all, noticing if they're in distress. So if a child is having behaviors that aren't characteristic of themselves, for younger children, say bedwetting or exhibiting increased anxiety, asking over and over again what's going on, then that can be an indicator that they might be experiencing some anxiety symptoms. And so, first of all, just recognizing and seeing, is my child exhibiting any of these symptoms? Is their behavior changing? And then also there are a few things that we can do that you can do as caregivers or parents as well. Keeping a routine for the child, making sure that they know what's coming next. They know what's going to happen on the day to day. And this can be a little bit challenging because as parents, you know, you're not used to also being their teacher in addition to their parent. And so I know that things have changed a little bit, but keeping those routines are really important for them. And then also not putting too much pressure on yourself as a parent. So while you are homeschooling the children, providing that homeschooling is good, but also giving them plenty of room to play, plenty of room for them to be outside, and to have some time to just express themselves is a really important thing to do for the children.
Thank you. So if people are interested in learning more about self-care or how to care for children in their lives or any of the other things that we've talked about today, where can they find out more information?
Yeah, so the School of Social Work will be hosting a webinar on self-care, compassion, fatigue, and reducing burnout in the upcoming weeks. And then also there are a number of resources online that people can look to. And in terms of these resources, one is the National Alliance for Mental Illness. Then there's also 0 to 3, which provides wonderful resources for caring for children. The CDC also has really great resources for your own mental health, but also for helping children's mental health.
Dr. Powell, thank you for joining us today. On behalf of the Joint Information Center, I want to remind everyone of the resources that are available at champaigncountycovid.org. as well as calling 211 for any community resource needs. Thank you.
Thank you.